Hello, this is Dr. David Kahn, Professor of Medicine in the Division of Allergy and Immunology at the University of Texas Southwestern Medical Center. Today, I'm going to teach you about anaphylaxis. Anaphylaxis is a severe allergic reaction that can cause you to die if it is not treated right away. It happens when your body reacts strongly against an allergen, most often foods, drugs, and insect stings. In this video, we will talk about how to know if you are having anaphylaxis and the important steps to take to treat an anaphylactic reaction. Anaphylaxis usually happens within minutes of when the thing you are allergic to gets into your body, but sometimes can happen several hours later. There are four main types of symptoms caused by anaphylaxis: skin reactions, stomach problems, trouble breathing, and blood circulation problems. Skin reactions are the most common symptoms in anaphylaxis. These include itchy rashes and swelling. The most common type of rash is called hives. This rash looks red, raised sores or whelps that can join up and become bigger. These whelps are usually very itchy. When the reaction happens under your skin, there can be swelling that can come on very fast. This swelling is called angioedema. Angioedema often can be seen on the face, most commonly in the lips and around the eyes, but can also cause swelling of the tongue and throat. The second type of symptom that can be seen in anaphylaxis is stomach problems. Nausea, feeling sick to your stomach, vomiting, diarrhea, like watery stools, and cramping pain in your stomach can all be caused by an anaphylactic reaction. Trouble breathing is the third symptom type. This can be caused by swelling in your throat or when the reaction happens in your lungs. Wheezing, coughing, and shortness of breath are all signs that your breathing is being affected. The fourth group of symptoms in anaphylaxis is caused by problems with blood circulation. This can cause you to be dizzy, confused, have a weak pulse, and maybe lose consciousness, fall out, or faint. It is important to remember these main symptoms of anaphylaxis because an anaphylactic reaction must be treated quickly. Epinephrine is the medicine used to treat anaphylaxis. It is injected into your outer thigh muscle of the leg and comes in auto-injector syringes called EpiPen. It starts working quickly and lasts for 15 to 20 minutes. To help you know when to use epinephrine, follow these guidelines. If you start having trouble breathing or symptoms of poor blood circulation, use your EpiPen because these are serious symptoms and you could die if they are not treated. If you have one symptom, for example hives, that keep getting worse, use your EpiPen. If you have more than one type of reaction, for example a rash and stomach problems, use your EpiPen. If you have skin reactions in more than one part of your body, use your EpiPen. Finally, if you are not sure, use your EpiPen. Epinephrine is very safe, so it is better to be safe and use your EpiPen if you think you might be having a bad reaction. When you use an EpiPen, you should always call 911. Anaphylaxis is a severe reaction that needs emergency treatment. Reactions can happen again several hours after the first reaction, so it is important to be watched closely by medical professionals after a reaction. In summary, to help you know if you are having anaphylaxis, look for the four main types of symptoms: skin reactions, stomach problems, trouble breathing, and poor blood circulation. Use your EpiPen if you think you are having a bad allergic reaction or if you are not sure. Call 911 so you can get more treatment and be watched in the emergency room in case your symptoms come back.